Good morning. Happy Saturday. I'm ready for a long discussion. I have a peek at the lake next to me, so I'll show you real quick. That just kind of keeps me grounded, just, something to make my heart smile. You know how I feel about that. And today we are discussing grief. So I cannot wrap this up in 5 minutes. So get a cup of coffee, a cup of tea, a glass of water, a smoothie. Get comfortable. I'm comfortable. I'm cross-legged on the love seat. I'm ready to do this. Let's tackle grief. I have a lot of folks dealing with grief. Some have lost children of all ages, grandchildren, spouses, best friends, pets. Grief is grief. And that also includes losing a relationship, a divorce, a breakup, losing your job. All kinds of things fall into that category. So don't speak down to someone who says they're grieving a loss. It's their life, it's their loss. Let them have their grief. As long as you are not hurting yourself or someone else, sweetheart, I want you to grieve in your way, in your time. And do not let anyone, for any reason, ridicule you or judge you for how you're grieving or how long you grieve. That's up to you. That's your heart, your soul, your life. You do it your way. There are not 5 stages of grief. There are as many stages of grief as you come up with in your heart. There are basic 5, for most people, but that's stereotyping and, blanket statements, and you can't do that, especially with an emotion like grief. It's raw. It will get better in time, but honey, I'm not gonna lie to you. I'm not Willy Wonka. I don't sugarcoat anything. Grief will always be there, but you adapt to grief. It finds a place in your life that you can live with it. But for the first 6 months to a year, it's awful. It is awful. In my personal experience, I have lost both my parents. I lost a daughter who was born prematurely due to domestic violence. I've lost a fiance. I've had grief. I've lost friends, classmates, colleagues. Through COVID, I think, let me think for a second. I lost, I want to say, just under 40 patients during COVID. I'm not saying due to COVID, well, overall due to COVID, I guess, but not due to them necessarily having the illness, because there were a handful of medical personnel who took their own life because they couldn't deal with it. They were dealing with PTSD and moral injury, and they just couldn't cope. So a lot of things fall under the blanket of grief. I want you to know, I don't want you to doubt what I'm saying. Just because your loved one has left your presence, they've left this life, I promise you, they still know what's going on in your life. Just because someone dies, goes to heaven, whatever your faith believes in, they're allowed a day pass. They get to come back and visit. I promise you, I am a psychic medium. I have done this my entire life, and I'm almost 65, so I've done it a while. And I do this on a regular basis for a lot of people. They will come to me and say, I just need to touch base with them. I want to know they're okay. And they will not only let them know that they're okay, they will fill them in on what's been going on in their life. Like, where are they in the room kind of thing, because they're listening, they're seeing, they're there. They're there for your children's weddings, for the birth, for the graduations, when you have to sell the house, sell the boat. They will tell me that you're wearing their favorite blue flannel shirt to bed every night, so you feel close to them. They will tell me about the child who's wearing their t-shirt, who's wearing their bracelet, just to feel close. That's their security blanket. They need that. So if you have a child that is grieving, let the child grieve. We are all entitled to feel whatever we feel, and that includes children. Let them grieve. Let them cry. If they start acting out, it's in all likelihood grief, and you need to sit them down and talk to them. Honey, I will talk to them. It doesn't matter. They need to know it's okay. What they're feeling is okay, and it's normal. They may be angry. That's understandable. There's ways to work through this. But it's okay for them to feel whatever they feel. It's not okay to act out. It's not okay for you to act out, and you're an adult. But it's okay to grieve and feel the feelings. Write them down. Journal. Absolutely, positively journal. If you're not into journaling, find a photo, or in your mind's eye, see a picture of the person that you've lost, and have a mental conversation with them. And you can do this every day. It doesn't matter. And tell them what's in your heart. And that may change day to day. You know, at one point you may be reminiscing about when you met, when you fell in love, when they were born, whatever. And you just want to share that. That's okay. And the next 5 minutes, the next day, the next week, you may be mad as hell. How could they leave you with all of this? It's okay. They understand your grief. They know. They have backup. They have lots of angels right there backing them up. And they're sending those angels to you to help you. And sometimes those angels influence people like me to reach out. And that's why I do what I do. And there's a lot of people like me. I'm not saying I'm the only one. But share what's on your heart. They can take it. And they do hear. They will leave you signs. They will leave coins, feathers. You might smell their tobacco smoke, their fragrance. You might feel a touch on your arm. They might come to you in dreams. Children, especially small children, under the age of 5, for the most part, 4 or 5, may have conversations with them. You may hold a picture of them up to a 3-year-old, 2-year-old who has heard you talk about someone, but they don't know, they don't have the recollection. And they will point at the picture and say, oh, well, that's Dad, or that's Grandma, or that's Aunt Mary, or whatever. They know. They will come and visit them and talk to them. They will come to you in your dreams. And that's okay. You're not hallucinating. You are not hallucinating. Once in a while, they will show themselves to you. And that will freak a lot of people out. A lot of people say, oh no, I would find comfort in that. Well, they do until it happens, and then I get the phone call, the hysterical phone call. They're happy, but they're scared. It's okay. Yes, they have gone to heaven. They get a day pass. They can come visit. It's okay. It does not mean they're in hell. It does not mean they have not passed. It's okay. But no, they understand what you're going through. They see what you're going through every day. And they will try and make it better. They will try to comfort you in the best way that they can. They will try to comfort your kids and your grandkids. Grief is awful and it's painful, but it's not the end. Because someday, someone's going to grieve us when we pass. And every family does it differently. And just while I'm on the topic of families and grieving, okay, when you have a family member in hospice, if you have a family member with a terminal illness, chronic illness, and it is time to start discussing end-of-life issues, listen to me closely. This is not about you. This is about them and what makes them happy and what's easiest for them and their passing and their transition. So stop making it about you. Listen to what they want. Do what they want, not what you want. A few years ago, I had a family fighting, physically pushing each other because there were 2 different religions in the family. They were each insisting on having the funeral their way. And we had this poor lady who was dying that was saying, no, 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 that's not even what I want. And nobody was listening to her until I stepped in. It wasn't pretty when I stepped in. I got firm. I can do that. I might seem sweet and kind, but oh, honey, if I'm protecting a client, a patient, a child, my family, welcome to Mama Bear. And I just told them, I took them outside her room and said, knock it off. You're the most selfish, egotistical group of people that I have ever seen. And that got him mad. Well, how dare you? We're losing our, I know, but nobody's taking into consideration what they want. It's not about you. It's about her. Once she passes, then it's about you, your grief. But right now, honey, it's about her. She deserves your respect. She deserves your loyalty. She deserves your love and support, respect. Listen to her. Do what she is asking. This is the final act of love for her. It's not about you. They came around. And her funeral incorporated both religions. It's called compromise, listening. It can be done. Just respect those that are passing. Respect those that are grieving. Holidays are coming up, depending on your faith. I think the next holiday, Muslims are getting ready for Ramadan. Passover is next, and then I think Easter follows. I think that's right. And so for different families, a lot of families will celebrate together, be together during these times. There are people that don't want to participate. They want to be alone in their grief. Respect that. If you're having a family gathering and they excuse themselves, check on them. You okay? You doing okay? It's okay to be by yourself for a while, I understand, but know that we're here for you. That's a lovely thing to say. If they're hosting and they can't do it anymore, if you see them, step out of the kitchen, step out of the dining room, and just go sit down somewhere and they're crying, I want you to say, don't worry about it. I got your back. Let me take care of this. You finish hosting. You explain to everyone, I think we need to leave now. You do whatever is appropriate, but let them grieve. Let them have their time alone. Be supportive. Be kind. Be kind to yourself. When you're grieving, you need a little extra self-care. Take time for yourself. If you have a family and you're grieving, so often we get consumed with everybody else's grief. What can I do to comfort this person and that person and make it easier for them? And you don't give yourself a chance to grieve. I want you to grieve. I want you to shed those tears. I want you to cry. I want you to reminisce. I want you to do whatever feels right for you. It's okay. And I do know a few people that once somebody passes, they've already grieved. They've grieved when they were passing. And people will say, well, it didn't even affect them. They didn't even cry. They didn't shed a tear at the funeral. No, they didn't shed a tear at the funeral because they shed all those tears in the hospital room, in the hospice. When you weren't around, they shed the tears. Don't judge how anyone is grieving. That's their business, not yours. I have your back. I am here for you. I know this is lengthy. It's almost 15 minutes. I'm sorry it's so long, but it's a big topic with big feelings and big emotions, and it deserves comprehensive conversation. A takeaway. I love you. I am sorry for your loss. I am so sorry for what you're feeling, but I'm here if you need me.